3 techniques that I used as a doctor of physical therapy to finally get rid of my Hoffas fat pad pain that I had for about a year after my last knee surgery. Hoffas fat pad sits underneath the patellar tendon and comes out on either side just like this. Unfortunately, this fat pad can get irritated, especially after surgery. And I would find pinching pain getting up from a seated position, doing a lot of knees over toes work, and turning with knee flexion at the same time. And because this fat pad is just finicky in general, I had to manage certain movements at times, but also did some manual techniques to help alleviate the immediate pain and irritation. I would take the kneecap here and lift it up to distract it, and then towards my hip to take that pinching pain off of the fat pad. And do some upward mobilizations of the kneecap to help take any pressure off of that fat pad. I would also do distraction of the knee. So pull my tibia and fibula down as my femur or thigh bone stayed on a chair. Or have a thicker band like this that you can wrap your foot around and lean back so that it can pull your leg and create a distraction at the knee joint. Lastly, I would modify movement when needed. When I felt my fat pad was particularly irritated, I wouldn't do things that I knew would make it worse. So in my workouts, I would modify my deeper squats, my deeper lunges, my knees over toes work. Doesn't mean I stopped all those things altogether. I just had to listen to my body sometimes and do something else. If you are dealing with fat pad irritation, I promise it will go away eventually. Hang in there, but it is a super frustrating injury. I dealt with my pain on and off for about a year after surgery. I'm here to tell you it's finally gone. I've had no pain for over 2 years, so it will happen as long as you do some of these things and you keep your knees strong and healthy.